Okay, let's talk about Botox. Let's talk about filler. Do you understand the difference? Is it something that you've seen and you're like, does that person have bad filler or does that person have bad Botox? I'm gonna break down for you what Botox is, what filler is, what it can do for you, what it can't do for you. So if you're ever interested in having it, you'll have a better understanding. And if you're not, at least you'll understand what other people are doing to their faces and why you don't want to do it. So let's start with Botox. Botox is a brand name. It is a brand name for a chemical that we inject into people's muscles, and it inhibits the contraction of the muscle. The generic term is neuromodulators, and there's a number of neuromodulators on the market. The most famous is Botox, but there's Dysport, there's Xeomin, there's Jeuveau, there is Daxxify. They're all FDA approved, and what we do is we inject them into people's faces primarily to affect muscles that contract hard. So when you do Botox correctly, someone has less movement. It doesn't mean they have no movement, they just don't contract quite as hard, so their face looks a little bit more relaxed. Where I like Botox the most is really around the eyes through here. To open up the eyes, you can actually raise the eyebrows a little bit, keep that furrow from, getting too heavy so you don't look angry all the time. But there's hundreds of places we can use Botox. We put it in the forehead to help smooth the forehead lines. We put it here for the bunny lines. You can put it underneath the nose to raise the nasal tip. You can put it here to help with gummy smiles. You can put it in the chin to help with that dimpling and wrinkling we get in the chin. You can put it in the corners of the mouth to help fight the downward turn. You can put it in the neck to fight the bands that we get and like the jowls that come down here. And that's just on the head and neck. We put it in people's armpits to help with sweating. You can also even put them in their hands and feet to help with sweating. It is a very well-loved treatment. It's also an incredibly safe treatment. It will always wear off. Doesn't matter how much you love it or how much you hate it. If you get a neuromodulator, it will be gone in somewhere between 3 and 6 months. So it's not something that's going to permanently affect your face, which is why it is a very, very popular treatment and a very safe place to start. The cost of these things is usually by unit, although some doctors or providers bill by area, so it's like a certain amount for the forehead versus a certain amount for around your eyes. The cost per unit can be anywhere from $10 to $25, and I really encourage people, if you're interested in having this treatment, go to a provider who you like the way he or she looks, you have a friend or someone who's had a good experience with that person, and you've met with them and you feel good about them injecting something into your face, because let's be honest, it is scary when somebody has control over the way you look. You want to make sure that they look normal and that you can trust them, and God forbid if something goes wrong, they can fix it. Things that can go wrong with Botox or neuromodulators is primarily two things. If you get too much, it can alter your appearance in a negative way. If you get too much Botox in your forehead, it can drop your brows and make you look sort of more Neanderthal or heavy through here. That's something that some men like, but most women want to maintain an arch in their eyebrows. And so to do that, we don't want to over-treat the forehead. If you over-treat the forehead and get too low, you can not only drop the eyebrows, but you can also drop the eyelids and make it hard to open your eyes. That's an incredibly rare complication, but it can happen. So the first time you get Botox, you want to make sure somebody goes very light so you can experience it with really zero risk of complication. Now around the eyes, if somebody injects too low down here, they can actually affect the muscle that allows you to smile. So it can make it so you can't turn up the corners of your mouth. That's a bummer, because then you'll have an asymmetric smile. It will always go away, but same thing, you want to inject right up at the orbital rim, and you don't want to use too much, particularly the first time you get Botox, because everyone's anatomy is a little different. On the lower face, the risks are just higher because the muscles are closer together, so you can have more complications. If you inject for the downturns of your mouth, you can sometimes get a muscle that takes it so you can't smile, and you have an asymmetric smile, so you can get an asymmetric smile from the top but also from the bottom. In the neck, if you get too much Botox, we're talking over 100 units, it can make it so your muscles feel weak, and it's like hard for you to do a sit-up or Pilates or a teaser, because you've actually weakened the platysma muscle. If you get too much Botox, in your hands for sweating. It can make it hard for you to grip a pencil. So the vast majority of complications from Botox is by injecting too much. So I encourage people to get as little as they can the first time they have it, find a provider that they really can trust, and then together you can work up to what might be your therapeutic treatment. If you think about how we inject these neuromodulators, they're a liquid, right? It's one of these things where it's a liquid. We draw it up usually in these small syringes, and we might have 3, 6, 8 of these syringes as we go around and inject you. That's very different than fillers. So let's talk about fillers now. Fillers are semi-solid. They are not as liquidy. They're not mixed with water, and we're actually injecting a substance into your face that will almost immediately show some increase in volume. There's 2 different groups of fillers. There are hyaluronic acid fillers, and that's what this is representing. And then there are biostimulatory fillers like Sculptra. Sculptra is a liquid. It is a solution. We inject it in, and then your body actually builds collagen on top of that. It is a beautiful product. It leads to really natural results, but it requires a bigger needle, and it requires your body to do a lot of the work, so you're not going to see those results for 3 months. Now, when we use hyaluronic acid fillers, these results you're going to see almost immediately, and they will improve over the 2 weeks after you've had the injections, because the filler will settle into place. Some of the lumps and bumps will go away. It will absorb water, and it will become sort of more uniform with your skin and look more natural. Hyaluronic acid fillers, there's lots of them out there. That is the Restylane, Juvederm, Voluma, RHA, Teoxane, Belotero, Versa. Those are all different name brands of hyaluronic acid filler that's available in the United States. The provider picks what type of product is going to work the best for you, depending on your skin texture and where we are injecting. If we want to give people bigger cheeks, we want to use a thicker filler. If we want to treat little fine lines around the mouth, we want a thinner filler. And so same thing, when you allow someone to do this to your face, look at them. Do they look normal? Do you like their aesthetic? And can they explain to you these basics about how they're choosing what they're injecting and why they're doing it and where they're doing it? I like to really agree on a treatment plan before I start with people, particularly when I first meet them, to make sure what's bothering them is what I'm addressing, or if what's bothering them isn't going to be improved with filler, then maybe we shouldn't do filler in the first place. So filler, as I already said, is a semi-solid substance. We inject it in. What is wonderful about hyaluronic acid filler is it's reversible, and there's something called hyaluronidase that we can inject to make any lumps or bumps or unwanted filler go away. But that process is imperfect. You can't immediately just inject the hyaluronidase in and make only the filler go away. When you inject the antidote, it actually breaks down your body's natural hyaluronic acid as well. So the goal here is to not inject too much the first time, so we don't have to reverse it going down the road, because that can actually be a long and very complicated process. What filler can do for you? Filler can add volume as we age and lose our cheeks and sort of gravity comes down. By using filler, we can actually add some volume back up to our cheeks to replace the loss of fat, bone, and muscle that happens. We can use it to define the jawline. We can do it to accentuate the lips. We can use it to trace out lines around the mouth and smile lines. It's not something that we use very much of in the forehead. You can very, very superficially, but there are a lot of important blood vessels here. So if someone's going to be injecting in your upper face, you just want to make sure they're an expert. We also do filler in the temples, because sometimes people have a lot of hollowing in their temples. Same thing, there's some important blood vessels there. So we want to make sure who's ever doing those injections knows what he or she is doing. We also sometimes put filler in the backs of people's hands to help with the tendons and hide some of those blood vessels in that area as well. The worst thing that can happen with filler is it can get into a blood vessel and stop blood flow going downstream. This is a rare thing to happen, but it can happen, and that's the reason why it's so important to only inject reversible fillers and to always have the antidote, which is the hyaluronidase. So when that happens, which is exceedingly rare, you can reverse the filler make the blood flow happen again and prevent any long-term complications. But it is important to know that there are some cases of blindness from injecting filler into the face, that filler getting into a blood vessel that provided blood to the eye, and it wasn't able to be reversed, which is incredibly scary, and it's something I live in fear of. But these are things that you need to know if you're going to take on the risk of having someone inject into your face. This is not something for the faint of heart. It's not something that should happen on a Groupon or at a Medi-Spa where there isn't a physician there who can really deal with the complications. So, backing up, what's the difference? Botox, neuromodulators, they treat muscle, they treat dynamic movements, they treat the lines that we make when we smile and we frown, and it lasts for somewhere between 3 to 6 months. Filler actually is for contouring your face, is for adding volume. When somebody has too big of lips or too big of cheeks, that's filler gone wrong, not Botox. Filler, for the most part, lasts somewhere between 6 months and 2 years, depending on the person and the type of product that's injected. Let me know if you have any questions. That was a huge amount of information, but I am here to try to help you understand this crazy world of skincare. My name is Dr. Heather Rogers. I'm a board-certified dermatologist. You can follow me here on YouTube. I also have a really active channel on social media, Instagram, as well as TikTok.